Hello, my name is Laura Lyons and I'm a SonoMed, and I want to welcome you to Module 4 of our clinical training for the neonatal intensive care unit. Today we'll be talking about the waveform analysis.
So now that we've set the carina distance, you can see in the green box here to the left-hand side of the screen, on the lower section it says carina distance 1.2 centimeters, as was determined by observing the chest x-ray. Before I go to the waveform function, which is this lower button and the lower icon here and the button to the right of it, I want to discuss what's up on the top of the screen. You can see, first of all, we have a battery indicator that has several bars that will be there indicating battery life. A fully charged monitor has about 2.5 hours of battery. If you plug in the battery to an AC source, you'll notice that a yellow plug comes on to indicate that you are directly connected to a power source and not relying on the battery. As you come across to the center of the screen, you can see the length of the endotracheal tube is indicated. And then on the far right-hand side of the screen, we can see what the oxygen concentration is. As we discussed previously, oxygen concentration on your patient can determine or can affect the speed of sound. So if your patient is on 21 to 60% oxygen, we would have it set at the reading you see now. If the concentration was greater than 60%, you'd have to adjust the monitor so that it would compensate for that higher concentration of oxygen. And we've showed that in the settings screen. We're going to show a way that we can do that in the waveform screen here in just a second. So let's hit the right button just to the next to the waveform screen. And now what we're looking at is the waveform through the endotracheal tube, which is this far left-hand box, at the tip of the endotracheal tube, which is this red box in the center, and then the echo, which goes down to the 5th generation of the lung. Again, we're using acoustic reflectometry. We're sending sound signals all the way down from the sensor to the tip of the tube into the lungs and measuring the echo as it comes back. This first box is the echo that is performed in the endotracheal tube. You'll notice this little bump here is where the sensor is actually connecting to the endotracheal tube. If we were to get an occlusion in the tube, you would see that show up on the monitor as a bump that becomes fairly large with the indication as to the degree of occlusion that occurs. And when that occlusion was cleared out, that would go away. You can see that the center bump is the endotracheal tube tip, and you want that centered into this narrow middle box. That will indicate that you've got the endotrach tube positioned exactly where you want it to monitor effectively. And we will show you how to move that echo if you need to later into the presentation. And then the far right-hand box is the echo. And as the endotrach tube moves, you will see that that echo can change. And if you notice here, the blue is the baseline. The easy way to remember that, B for baseline, and the blue indicates where the tube was originally when we set the baseline. The yellow indicates that the tube has moved. If the yellow moves to the right of the screen, the tube is moving out or migrating out of the patient. If the tube moves, or if the echo moves to the left, it indicates that the tube is getting closer, the endotrach tube tip is getting closer to the carina. What we look for in this waveform is we want one fairly significant echo with a yellow line going through the center of it, and that's where we tend to take our reading. If there's several small bumps where this yellow line can be moving back and forth, it can make it hard for the monitor to take a reading. So sometimes when we come to the waveform section, we want to look for that good solid echo and that yellow line right in the middle of it so that we know that we're getting a consistent reading. Different anatomy can create different situations, so this is a way of double checking to be sure that the echo that we're receiving is an accurate echo. As I come up on the waveform screen, you can see that there's a button right here with a 10 on it. As I hit that, this is the sensor health, and this is indicating the relative health of the sensor. Below 7, the sensor may start to have issues. It'll turn red when the sensors aren't working, and would mean that you would need to replace the sensor. This is a feature that probably wouldn't be used very often by the clinician, but it's there nonetheless. Keep in mind that this sensor you can lavage through, you can suction through, you can hook a bag up to it and bag through it, and it will not damage the sensor. So we don't need to worry about that part. But if you ever need to check the sensor health, you just simply hit the button to the right. Now I mentioned earlier that we've got measurement up here in the length of the endotrach tube and the oxygen concentration. If we use the right and left arrows, you'll see that the minute we hit that arrow, it lights up the oxygen concentration. If I hit the center to enter button, it pops up the O2 concentration that we had done before in the settings. I can go down to the 21 to 60% concentration, hit enter, and I can increase that to 61 to 100%. Notice how the echo changed because the monitor is adjusting for a different concentration of oxygen. And if I change that back to where it was, you can see the echo comes right back in line. So that allows me to change my oxygen concentration if I notice that it's incorrect. If I go over to the center section on the endotrach tube length, again, I can adjust that. And if you notice, as I decrease the length of the endotracheal tube, you'll see that the tip moves to the right. And if I increase it, the tip moves to the left. And if for some reason you have a tube that was cut and it wasn't adjusted appropriately, you can use these up and downward arrows to center the tip of the tube echo right in the middle of that box so that it reads accurately. And that covers the waveform function of the monitor, the airwave movement through the endotracheal tube itself, at the tip, and then in the lung cavity at the far end. To get back into the regular monitoring, you simply hit the icon or the button to the right of the lowest icon, and it'll take you right back to where we were monitoring originally.
So here we are again, back to the main monitoring screen. And we have our baseline information in there now. So I'm reading any movement that may have occurred, and right now I don't have any movement in the endotracheal tube at all. I also don't have any obstructions in the endotracheal tube, and I know that I have a trachea that's 4.9 millimeters in size. This screen's really easy to understand, and the waveform is too, but it takes a little more time to understand it. So we're going to spend some time going a little more in depth into the waveform screen. Now remember, to get there, you press that bottom oval button by the icon that looks like the waveform. So here's the waveform screen, and in the video Tom talked with you a little bit about the top, but let's go over it again. This is on both screens, but here's my indicator showing my battery and how full it is. In this case, I actually have the power cord plugged in, battery's charging. This little indicator shows I have my alarm silence button on. And again, that will go on for 2 minutes and then cycle off. This tells me the size of the endotracheal tube I chose to use. In this case, it's an adult size that we're looking at, a 7.5. That icon up at the top tells me what oxygen concentration I have set. Remember, this monitor does not tell you what the oxygen concentration is. You will enter that in there. This number on the right is simply the amount of memory I have left to store data in. That can get totally full and it doesn't matter. You can erase that if you need to, but the monitor continues to function fine even if the memory is full. We've talked about the sensor health screen, and that's that number 9. Rarely will you see a need to use that, but sometimes in troubleshooting on the phone, we might ask you to look that up. Remember, baseline is blue and current is yellow. That's the information at the top of your screens. Talked a lot already about the waveform, and we've talked about the 3 windows that are in there and what they mean. And again, we're looking at 3 distinct echoes. We have an echo or echoes in the endotracheal tube itself. We have echoes around the tip of the endotracheal tube telling us the diameter size of the trachea. And then we have echoes down in the lung, echoes that come back from the lung. Let's look at the waveform screen again. And so I've got the 3 different boxes. And again, it shows me I haven't had any movement of my endotracheal tube and that I have a 5.2 millimeter trachea size. Look at that thin red box in the middle, or rectangle in the middle. Tip, or sometimes we refer to that as passageway, but you can think of that as the diameter of the trachea. And as you see the little words larger at the bottom and where the green circle is, that's measuring the diameter at the tip of the tube. And the farther down that echo goes into the tube, the larger the trachea is. If it was smaller, then you see it at the top, such as if it was in an esophagus even, you would see the echo going upward. We're going to focus most of our time on this box, however, and it kind of looks gray-blue when you look at it on the screen. And this is an echo that's coming from the lung. I'm going to give you some things to think about, because this is going to feel backwards to you as you're thinking about it. But let's start with this. Basically, the vocal cords are over on the right. That little line there shows you the position the ETT is in. Currently yellow, right, is where it currently is. The carina is over to the left of this box. Okay, we already talked about this red thin rectangle in the middle being the tip or the diameter of the endotracheal tube, the diameter of your trachea or bronchus or esophagus. We sometimes call that passageway. And then that far box again is any obstructions or occlusions we may have in the endotracheal tube itself, inside the endotracheal tube. So let's talk for a minute about how long our trachea is anyway. Probably all learned this in school. I didn't remember it when I started using the SonorMed Airwave. So we're going to be talking about neonates, and we're going to talk about 2.5, 3, and 3.5 size endotracheal tubes. The literature shows that a baby who's using a 2.5 millimeter endotracheal tube has an average tracheal length of 4.0 centimeters. And then we move up to a 3.0 tube, and their trachea has grown to 4.7. And if I have a 3.5 tube, I've got about a 5.5 centimeter trachea. Those are the averages. How's that going to help me, and what kind of information can I get from this waveform? And again, we're going to spend some time looking at the far right box. That's the echo that comes from the lung, and see what that means. This is going to tell me where in the trachea my tip of my tube is. So where am I in terms of distance from the carina and distance from the cords? So I'm going to look at it this way. In this box that I've now placed up there, I see a tip of the tube that's quite low in the trachea. I'm close to the carina. However, this one shows me I'm just right midline almost, right in the middle between the carina and the cords. And this one, this echo, shows that I'm really pretty high in the trachea, very close to the cords. If I'm looking for a position for a baby with a 3.0 or a 2.5 tube, I'm happiest with that left box. Might be a little low, but I like the position of the trachea being closer to the carina. Certainly, I don't want it closer to the cords. And midline for a tiny baby might be a little high. So when we use this waveform, and we use that airway window, as we call it, on the right, we can find the ideal location for the ETT at the tip, not at the lip. And you see this immediately upon beginning to monitor. So how do we know what an ideal position is? Again, we're going to use our average tracheal lengths to discuss what is ideal. Where do I want the tip of my endotracheal tube? And let's start with what we call the safe zone. Literature will say that the tip of the endotracheal tube really needs to be at least 1 centimeter above the carina and 1.5 centimeters below the cords. That gives us a safe zone. But the safe zone is going to be different length for each size trachea. So let's start with the 2.5. In a 2.5, if I want to be 1 above the carina and 1.5 below the cords, I've got a safe zone that's 1.5 centimeters long. So I can tolerate a little bit of movement, but not a whole lot. So if I have the tip of the tube above the carina by at least 1 centimeter, then I have 1.5 centimeters that I can move before I get into a danger zone where I may be ready to extubate, self-extubate the baby, right? And we don't want unplanned extubations. That's one of the whole points of this, is that I can watch the tip of the tube continuously and carefully monitor where it is so that I know my baby's endotracheal tube is safely placed in the trachea. So if we think about the ideal tube tip location for a baby with a 2.5 millimeter endotracheal tube, our smallest little preemies, then really it's between 1.2 and 1.5 above the carina. We still have a little bit of room for upward movement then, but we're not too terribly low in the endotracheal tube. In the trachea. So let's look at this a little more. Again, I'm looking at the far right box. You see the words cords and the carina. So the right of the box is where the cords are. The left of the box is where the carina is. This is my airway echo. I happen to have this on a 2.5 millimeter endotracheal tube. So let's look a little more in depth at the box, right? I see a couple of different things. I see the blue and the yellow echoes, right? I see that straight yellow line that goes down in the middle of my echo. And I see little tick marks below the word airway. The tick marks are actually centimeter marks. So if I look at this, I know that I am about 1 centimeter above the carina with the tip of this tube. Here's the tip of the endotracheal tube. And I am, again, the cords are here roughly, carina is here roughly, and so I'm about 1 centimeter above the carina. Let's look at it a little differently, and this may also help you to understand this airway echo a little better. So here I've taken, I have the two boxes in. We're looking at the far right one. And I've really taken this and I've divided it into divided that box into fours by centimeters, right? You see the centimeter markings at the bottom. And so this tube is 1 centimeter above the carina. Okay? We'll talk a little more and it'll be more clear with each slide as we go through. So now let's look at a 3.0 millimeter endotracheal tube. Back a few slides ago, we talked about the fact that an average trachea for a baby using a 3.0 millimeter endotracheal tube is 4.7 centimeters. So I have a little bigger safe zone, right? I want to be 1 above the carina, 1.5 below the cords. So now I have about 2.2 centimeters in the safe zone. So what would you think is the ideal location for a baby with a 3.0 millimeter endotracheal tube, knowing their average tracheal length is 4.7? So we want to be at least a centimeter above, and in this case, if we're 1.2 to 1.6, we're still going to be in that safe zone and still leave a little bit of room for upward movement. Hopefully before we started this, you received this slide and several slides more where you actually can practice drawing the echo where you'd want to see it. So if you look at the echo for a 3.0 tube, where would you want it to be? Again, we want at least 1 centimeter above the carina and probably a little bit more, right? But we don't want to be too close to the cords. So when you're looking at this real time, you're going to know where the tip of the tube is and you're going to know if you have an ideal location. Let's talk about a 3.5 millimeter endotracheal tube. The average tracheal length for a baby using that size tube is 5.5 centimeters. So now my safe zone just got a little bit bigger. Again, I want to be 1 centimeter above the carina and at least 1.5 below the cords. So I have a safe zone of about 3 centimeters. Where do you want the tip of the tube then? Now I can say if it's at 1.5 above the carina, I'm okay. And even edging up to 2 above the carina, I still have a little bit of room for movement without still being safe. So again, here's an opportunity for you to use your artistic skills and draw the echo where you would want to see it for a 3.5 millimeter tube, knowing that I've got about 5.5 centimeters length of the trachea. Now I've got 4 different boxes for you to look at. Study these for just a minute. So as you're taking a look at the 4 different examples, these are all for a 2.5 tube. You know that because you see it at the top in the center, 2.5. And they all look a little bit different. So let's talk through them a bit. The first one on the top left, that's looking a little strange. In fact, that looks like a W. I'm not sure if I like that a whole lot. Let's move to the next one, top right. The tip of that tube is almost on the carina. Not sure that looks too good to me either. Let's go down to the bottom left. The tip of that tube looks to be roughly 1.5 centimeters, 2 centimeters above the carina. And then the bottom right, now I've moved up to closer to 3 centimeters above the carina. So if I have those to choose from, I would say my favorite position in these 4 pictures is the bottom left. I'm about 1 centimeter or 2 above the carina, and probably I want it just slightly lower. Okay, let's try it again. Now we have a 3.0 millimeter endotracheal tube. And you know that because it tells you 3.0 at the top. Look at those for a minute. They all look very different. Can you tell which one is closer to the cords? That's the one on the top left. That's very high in the trachea and at a high risk for extubation, unplanned extubation. And then there's 2 of them that look like they're really pretty low in the trachea, and those are both on the right. So the one on the right and the top is showing me that I have a 5.2 millimeter trachea and that I'm only about 1 centimeter above the carina, but I am above the carina. The one on the bottom right shows me now I have a 4.1 millimeter trachea, and I'm right on the carina. In fact, with that signature, I'm actually, the tip of the tube is right in the bronchus. Certainly don't want that. And if I look at the bottom left, I see that I'm pretty much midpoint, right? But a little bit beyond midpoint, which concerns me a little again. That puts me at a little more risk for an unplanned extubation. So I would choose top right as the position of these 4 that I'm the most comfortable with. All right, let's try it one more time, only now with a 3.5 tube. So I've got one that's pretty high, 2 that are kind of low, and one that's right in the middle. Are you beginning to see that now? So the one on the top left is right in the middle of the trachea. Not bad, but still midpoint for me feels a little bit high. Top right, pretty low, probably only 1 centimeter above the carina. Bottom right picture, way too high. That looks like it's only about 1 centimeter below the cords, just waiting for an unplanned extubation. And then the bottom right, about 1.5 centimeters above the carina. So that's the one I would choose. Hopefully this is all making a little more sense to you now, and as you see it on baby after baby, it will really become easy for you to read. You'll be able to walk up to the monitor and in no time say, that's 8 millimeters above the carina, or that's 1.5 centimeters above the carina. Just takes a little getting used to. So here's a few more opportunities for you to draw where you would like to see the echo at a 2.5, 3.0, and a 3.5 tube. If you've printed out this page, you can draw them on this, put your name and date, and turn that in for us to see if this is crystal clear to you yet, or if we still need to do a little training. This brings us to the end of this module on the waveform. Hopefully that helped clear up a few things, but know that we're still here for questions, and we will continue to go over the waveform with you in person every time that we see you. In no time, this will become easy for you to read, and you'll come to rely on these screens a lot. Thanks so much for your attention, and again, should you have any questions, you can contact us, any of the cell phone numbers that we've given you on our cards, or you can go to www.sonarmed.com and go up to the Contact Us and put in your contact information, and we'll get back in touch with you. Thanks so much for listening.